Well, hello everyone. Welcome to Agents of Change Continuing Education. Today we have Mattia Lewitt, an LCSW, who will be covering a really great topic with us on military children and families. So really learning about this, no matter where we're practicing, because we might be encountering these clients in our practice in the agencies that we're working with, even if we're not specifically geared towards this specific population, we can see these clients coming into our spaces. So we're really excited to have you here, Mattia, to cover this topic with us. And to get started, I'll go ahead and introduce ourselves. So whoever's tuning in, my name is Bonnie, and I am the continuing education lead here with Agents of Change Continuing Education, where we are here to bring you material to better your practice and learn lots of great things. Of course, we started with the test prep side, so we're really glad to expand on ensuring that everyone's really prepared on what they're applying with their clients and in their community, and getting to expand the knowledge that we're needing to, of course, keep our license as well. Some of my background, I do have my bachelor's and master's in social work. I've worked with foster children. I've worked with substance use, also worked with group counseling sessions for clients. And with that, we really get to serve lots of different populations. I myself have encountered working with military children or families, even in these populations. So I'm really excited to learn and, of course, have you all learn with us today. Let me go ahead and introduce our speaker. Sorry. So we do have Mattia Lewitt with us, which, as I mentioned, she is a clinical social worker who is dedicated to helping individuals and families, in which she has developed skills necessary to create and sustain meaningful change, just as we here are change agents, right? She brings an extensive experience working with adults, children, especially that infancy age all the way to 18. And this is something that she works with families across from the homes, the school settings, and even in community mental health settings. Matea has experience in trauma-focused cognitive behavioral therapy and has completed advanced training in prolonged exposure therapy and cognitive processing therapy. And her clinical approach here emphasizes this evidence-based interventions and holistic trauma-informed care, which is really tailored to each client's unique needs, because we do know that we can kind of focus in on what that broad area is, and each client being very unique and very individualized. And over the course of her career, she has supported clients through challenges such as depression, anxiety, life transitions, trauma, including the unique experiences of veterans and military families. So she's deeply committed to fostering resilience and emotional well-being. So we really get to learn about this and how to apply this compassionate and collaborative therapy as well that she's here to share with us today. So thank you so much for being with us. I'm going to go ahead and share a little bit on why this is important, right? Why are we here today? So of course, with working with military and children families, understanding frequent relocations, understanding the stressors that come with being exposed to this military lifestyle, which we'll get into, and access to care and making sure that we as mental health professionals are able to step in with providing them resources, especially, as I mentioned, those relocations, right? So I'll go ahead and get started. I'd like to just turn it over to you, and if you can kind of share what is it that brought you to this, working with this population?
Sure. So I had a fairly unique opportunity to work with military kids and families because for 4.5 years I was working at a clinic specifically focused on serving military children and families, offering short-term, time-limited, evidence-based therapy. And while I didn't have an interest in serving military kids and families beforehand, I am really committed to helping underserved populations. And so that was something that was really appealing to me. Also, I realized in my work at that particular job that I didn't know a lot about this beforehand, and that in fact, most social workers don't know a whole lot about this. And so it's really important to me to be able to share what I learned and help other people. Because even if you are not specifically in a military setting, you probably are seeing veterans and military kids and families potentially, depending on where you live and where you work.
Yeah, definitely. Thank you for sharing that with us because it is an important part that we are preparing ourselves because we can encounter these specific individuals in any setting. So really making ourselves knowledgeable in this to how is the best way that I can serve these clients. So with that being said, what are some of the unique challenges that military children and families face compared to maybe civilian families?
I would say that there are several unique challenges that military children and families are going to be dealing with. One is frequent moves, which obviously we have that highlighted here, frequent relocations. Military families move much more often than their civilian counterparts. Um, Childcare is obviously an issue for any family, particularly because these families move more often. They may not have family support the same way that civilian families might. And moving is disruptive all over the place. So it disrupts childcare, it disrupts school, it disrupts after school activities, and it can really affect family stability. So another thing that really affects these families is that military spouses are very likely to be underemployed or face larger gaps in their work, which of course is going to impact family well-being because it impacts financial well-being, stability, their ability to manage all of the different things that families need. There also are cultural differences that I think may not be widely appreciated. So, of course, we know as social workers and as mental health professionals that we want to practice from a place of cultural humility. We don't know everything about other people's cultures. We want to be respectful. And there are some unique challenges in working with this population where military culture is its own thing. And because many of us don't work with this population regularly, we might not even know what questions to ask. So I think just approaching military kids and families from a place of curiosity is going to be really important and helpful in you being able to serve them well.
Yeah, definitely. Thank you for bringing that up. Would you mind sharing some examples as far as how we can set this space up and ensuring that it is a safe space for them? Because it definitely is a really different culture. So if you can explain some examples on how you approach this.
Yes, I think there are a couple of things that we can do that are going to be a pretty low lift in terms of the amount of effort, because I know we're all busy people. So I would say one thing to do is make sure that your paperwork is asking about appropriate experiences. So you could ask in your paperwork, do you have any family members who served in the military, or did you serve in the military, depending on who your identified client is. You also want to acknowledge that people may have different levels of identification in terms of military culture, and you want to design your space in a way that is respectful and welcoming to everybody who might pass through your doors. So when I was at my previous job, working at the military family clinic, we had specific art that was designed to be appealing and welcoming for the kids and families who walked through the doors. We had the seals of all of the different branches. We had Philadelphia specific art because we were based in Philadelphia. And we tried to think about what's the whole process going to be like from when somebody contacts us through when somebody leaves, and to figure out at each point in time, what are the specific needs that somebody might have. So asking questions like, did your family member ever deploy? Or was there a time where your family had to move? The military term for this is PCS, for permanent change of station. So asking questions in a way that shows curiosity and respect is really important. You will probably never learn all of the language, but do try to make an effort as best you can.
Yeah, definitely. Thank you for sharing that so we can keep these questions in mind and also just be aware of it as well. Are there any specific developmental concerns that arise, especially more often with military children?
I don't know of any, but would say that because military children may move around more and may change providers more often, it might be easier to miss concerns because of these changes. I think there's also a possibility that the schools are not necessarily going to be picking up on things as easily because they might not know the students as well. So if we think about a child who is in the same school district and in the same schools throughout their entire life from grade school through high school, the teachers are likely to get to know them really well and get to know their family and get to know their needs versus a military family that might move 2 or 3 times more often than a civilian family where they don't have that continuity.
Definitely. And so, in your experience, how do schools and communities typically respond to the presence of military families? Because I see that you had, these different experiences to helping in the home, school, and in the community.
Yes, I'm going to say this varies a lot because there are some communities and schools that know that they have a lot of military kids and families and are more set up to be able to support them. So um, there are certain states that have really large military bases and therefore really large military family populations. And so the schools and communities in those places are going to ask kids about it and ask their families about it and be more attuned to what they might need versus the schools and communities in most places that don't necessarily know that they have military kids or don't even ask, so they aren't aware of it as a thing that they want to be considering.
Definitely. Yeah, and I see that there's definitely even like specific cities that are like the bases. So we can definitely see that more prepared. So definitely seeing that approach in the school setting or even around the community. So thank you for sharing that.
Sure.
Um, how can social workers or just mental health professionals in general effectively support military families through deployments and through these transitions that they experience?
I would say the best way to support the kids and families is going to be to ask them about what's helped them before, what's worked for you before, what hasn't worked for you before. And particularly social workers, but obviously other mental health professionals, we are really good at knowing the resources and knowing what's out there. So if we say, here are some of the things that are available, is any of this of interest to you? Would you like to get connected with other military families? Would you like to talk to the school counselor? Would you like to talk to this particular person who might be able to help with this transition? Knowing the resources is a really, really great way to help support these families.
Yeah, thank you. So definitely preparing our clients for this and having that communication, being aware of those movements. Um, how often do you see the deployments or transitions having occurring and preparing the clients for?
I think that's a really great question because the frequency of deployments actually can vary quite a lot. Some units deploy more than others. It depends on what somebody's military occupational specialty or job title is, and it depends on what their unit does. Right now, because we have an all volunteer military force, and because of various conflicts, um, units are often deployed more frequently than in the past. And so it may be that in the deployment cycle, there's the pre-deployment, the deployment, the coming home, and then even just preparing for the next deployment. Some some veterans and some service members have deployed a lot of times. And so talking with families and putting systems into place that are flexible and structured is really, really important. I think that getting into the details is valuable. And I also think that technology plays a role too, because we have a lot of access to technology right now that didn't used to be available. It can also be frustrating because if somebody wants to talk to their parent or their family member when they are somewhere else, there might be unpredictability around when they're free. They might not have access to something, even if other days they did, and there can even be lag. So allowing for frustration and being like, yeah, that's okay. How can we handle that is really important.
Yeah, thank you for sharing that because I have been able to hear that, stressful experience through that transition from clients, and not really understanding, which can vary. So we need to keep in mind how many times has this family or this child moved and it affecting them, because we do know that, that can have a big effect, especially with children that really wanting to build relationships. But of course, for families as well, where it's important to build support and networks and trust within people for many reasons, right? So, thank you for sharing that. So, what are some strategies that have worked well in helping families prepare, cope for these deployment cycles?
I think figuring out how to help the family be informed and prepared is really key because this deployment may be similar to deployments in the past and it may be different. Um, I would talk to the families about who's in their social support network. Do you have family members who can help you? Do you have friends? Do you have neighbors? Do you have community members? Just thinking about who are the systems around you who can help you get through this is really, really important because predictability and regularity and consistency are very, very key for kids. Also, if a parent is not used to going solo, they may need more support. And so, thinking in advance, who can take care of your child so that you can take a nap or have a shower or have a break, especially depending on the age of the child? Like, things are going to be different for somebody who is parenting a baby versus parenting a school age child versus parenting a teenager and considering what you might need, what resources are available, maybe even putting together a little guide to get ready before you start could be something that is helpful for families because then they'll have everything available when they need it.
Yeah, definitely coming up with that guide is a really, really great idea. Thank you for sharing that. And can you speak to the role of the psychoeducational part in empowering these families, whether it be the guide or maybe something different?
Sure. I think that talking about some of the different experiences that the family member may have during deployment and that the family members at home may have during deployment is important because even if they've been through it before, it may be different this time around. And we are different when the same things happen to us. It's like reading a book again. The book is the same, but you may have changed. So if, say, a parent was taking care of a 2-year-old, maybe now they have a 5-year-old instead of the 2-year-old, and their child's needs will be different. I think that it's really important to understand what what might be needed at any given stage and to be really thoughtful about getting connected to people who can help support you.
Definitely. And do we see some of this happening in virtual spaces as well, to where maybe they have some of the support as they're moving through different spaces? Of course, it kind of depends because we do have to ensure that we're meeting those licensing requirements. But do we see that happening as well now that a lot of services are virtual?
Yes, I think that things do happen in virtual spaces. It's just harder sometimes to know what's going on because you're not getting as much information. And I do think military families in particular are really resilient and have lots of unique strengths. Also, there are online support groups. I'm not sure off the top of my head exactly what resources are available for helping parents and families, but I would say that there are resources within the military to have a contact person. I forget what the exact title is, but it's some sort of behavioral health coordinator who they can go to for help. And sometimes it's only for the service member, sometimes it's for the family, but knowing what is out there and doing your research is really key.
Yes, definitely. So, in this, how do military children experience and express trauma differently, and what therapeutic approaches have you found most effective?
Such a broad question, it's hard to know where to start with that one. I would
Mm.
say that some of the differences for military children would be related to family and community and cultural expectations for appropriate behavior and appropriate emotions. The main kinds of therapy that I use with kids, military or civilian, are going to be pretty consistent: play therapy, trauma-focused cognitive behavioral therapy, parent guidance, psychoeducation. Um, and obviously, with anybody, we want to be able to tailor therapy to their unique needs, even if a child may have experienced the same trauma as somebody else you worked with. They are different, and so their experience may be different. I do think also there are some really great resources out there specifically for helping military kids and families. So the National Child Traumatic Stress Network has a whole section on the unique issues for military children and families, and that's a great starting point because it'll help you with preparing, knowing your population, all of that good stuff that helps with you being able to be really present and really attuned and not have to have your clients educate you a lot about military culture.
That's definitely a really great resources to be aware of. So thank you for sharing that. What are some of the maybe differences that trauma look like, especially in young children whose parents have been deployed into a combat zone?
Sure. Separation anxiety is probably the biggest. I would say this can look different depending on the child's relationship with the deployed parent and the parent at home. Um, Also, thinking about what other family members are around is important. Will grandparents or aunts or uncles or cousins or chosen family, neighbors, community members come help? I think that particularly with young children, sometimes signs of trauma can be more subtle. Like it might show up in their play rather than them saying, I'm sad because I miss daddy or I'm sad because I miss mommy. Because when we think about it, play is the main language for kids, and so they are likely to express things that way. And if you're concerned about a child that you're working with, it's okay to consult with somebody else and say, I saw this, I don't know what's going on, can you help me figure it out? It's actually much better to consult with a trusted colleague or supervisor than to just go at it on your own and maybe miss things, especially if you're stuck. I always advise consulting.
Yeah. And then of course, maybe with certain diagnosis, we're aware of, is it happening just in the home setting? Is it happening in the school setting? Just one or both? And of course, maybe community settings as well. So thank you for sharing on that. Um, and I'm not very familiar with this, like in a very, very personal aspect. But I have seen some things in which there's, to my understanding, there's almost like this like tap out thing. I'm not sure if you're aware of like, it seems like they have to like tap out the person who's in uniform when they're returning. I'm not sure if it's from training or from when they're returning, but I see that the individual almost has to stay very, very still until they get tapped out. And so I, from watching some of these videos, it kind of hurt me because how does a child kind of react to their mom or their dad being away for so long and being so serious because they have to be in their stance and not being able to move until they're touched in some way. So like as they prepare for a hug, or I see some people just kind of put their hand and then that's where you see the reaction of them hugging their family.
Mm.
Um, are you aware of what that is, and can you explain maybe what it is and the effects of it maybe just on that slight thing?
This is not something I'm familiar with, so this is the first time hearing of it. But my guess would be that if that is something that the parents are expected to do, that it would be really confusing and disruptive for the kids if they're not expecting it. Because many parents, hopefully lots and lots of parents, will enthusiastically greet their kids with a lot of love and warmth and energy when they haven't seen them in a while. And if the child is there wanting to connect with their parent and the parent is frozen or stiff or not engaging with them, the kids could experience it as some sort of rejection or thinking, oh, I did something wrong, because we want to make sense of the world and blaming ourselves is a really common strategy when things are weird.
Yeah, and I'm not sure if it is coming from like a training base, but I did see it come up more recently, and that was my first observation. I was like, oh no, like these kids are, and of course, even as families, it might be hurtful, but with children, it's a little harder to understand and comprehend of, okay, this needs to happen before, getting the reaction, or genuine reaction that we might be expecting or looking for, as kids. So I was just curious on that. So thank you for
Right.
sharing that.
Yeah, I would want the other family member to prep the child to be like, "Hey, this is what's going to happen," so the kid isn't, standing there freaking out.
Yeah, definitely. And to understand as well where that's coming from and why. So they don't have that feeling of rejection or questions around um, you know, lots of different things that can be curated there.
Yeah.
Thank you. And what have you seen as being a success with TF CBT in this population?
Well, to be honest with you, most of my experience with TFCBT was when I worked in community mental health rather than when I worked at the military family clinic. So I don't know how much TFCBT has been studied in this population, but one of the big aspects of TFCBT success is being able to be flexible and culturally responsive and also faithful to the model. So I would say that the limitations of TFCBT are that it is a model, it is a great model of therapy. It is not going to be 100% successful or 100% successful with everybody. It is also just true that if kids have experienced complex trauma as opposed to just one traumatic event, they might need something different. And so they might need more extended TFCBT. I would say that the main ways to measure success are to be checking in, to be noticing progress. Sometimes using measurement-based care is helpful. So the main measure that we would use for measuring child post-traumatic stress is the CPSS scale, figuring out what is going to be appropriate and workable for your setting.
Yeah, thank you for those resources so we can keep in mind it being broad and understanding those limitations there as well.
Mhm.
Yeah. What do you see as the greatest need of non-deployed caregivers during these deployments?
I would say that there are a few main needs. The biggest ones are going to be unsurprising based on what I said about the challenges of these families: childcare, money, respite, like needing a break, and emotional and logistical support. These caregivers are under a lot of stress, and also they frequently have a lot of pride because they're really proud of their family member who's deployed, and it can be very hard to ask for help. I think that many military families will end up leaning on one another, but if you've moved around a lot, you might not necessarily have those kinds of relationships with people locally. So figuring out who can come help you, who can help you from afar, are there resources that other people have access to that they have found helpful that they can tell you about? It's just a really hard thing, and because deployments sometimes vary in length from a shorter deployment to a longer deployment, families may need different things over time.
Yeah. And so with that being something that these families experience, especially with caregivers, how does caregiver burnout manifest within these military families for us to keep in mind as we are helping them?
Similar to civilian families, military family caregivers are going to be dealing with a lot of similar stressors. They're frequently underpaid or underemployed due to moving for spouses' jobs. Um, the Interstate Licensure Compact was created, or the idea of an interstate licensure compact was created specifically to support military families, but they're not all active for all professions. And so because somebody might be a social worker and the social work interstate licensure compact is not active, they may not be able to maintain continuity in their work. Um, it's also important to prepare and to have systems that work for you. So if if caregivers are busy taking care of their children, but they're not able to take care of themselves, they might not get to a new provider's office until they are burned out and exhausted. And it's going to be much more difficult to remember to send over your medical records and give somebody an accurate representation of your history if you are exhausted and overwhelmed from everything that you're doing. So I think that we want to look for the same kinds of things, but there are unique military stressors like deployment, like relocation, like all of the work involved in changing schools, separation from family that we want to be especially tuned into for this population.
Yeah. And there's a lot of things that kind of come to mind for me just from that response. So if we're coming from this macro based of, okay, am I wanting, like anyone who's tuning in, if we're coming from this macro based, are we wanting to advocate much more for states who are still needing that compact to be signed, and understanding the importance behind it with this population, and of course, many other things, as well as some of the other things that you were mentioning, just noting like those changes and effects that these individuals go through or families go through. And as we understand, when we go through change, we are also processing lots of emotions around grief, right? So, understanding and building our skills on that, or utilizing the skills that we do have with these populations, given the amounts of change that they are experiencing with deployments and movements and changes. So, thank you for mentioning that because there's a lot there. And I hope that those of us who are listening and tuning in, we see, the different ways that we can definitely apply this into our practice. What are some community supports or interventions that you've seen that really make a difference?
I think one of the biggest ones is the natural communities created by military spouses and military families. That is one of the best resources that I know of. I would say also we as social workers and as mental health professionals can help families get connected to other resources. There are tons of different organizations that are around. Obviously, some of them are going to be more helpful than others. There aren't as many organizations that are specifically geared towards supporting military families compared to the ones that exist to support veterans. So I would say do your research, know what exists in your area, think about what people might need in your setting. So if you are in a primary care setting, you want to focus on health needs. If you're in a school setting, you want to focus on educational needs and family and community needs. Think about what the types of things are that people need besides the services that you have, and learn what other providers are out there. What else are people doing? Where else are your clients going besides your office, virtual or in person?
Definitely. Thank you. And how about how us as social workers can help these caregivers access the services, especially across those state lines, whether it be with the compact license or maybe not, depending on where we're coming from.
I think the first step for that is going to be asking people about what they already know they need and what they think they might need in the future. Because if we can anticipate things, we are more likely to be able to manage them appropriately, and we're more likely to help people feel prepared. We also can do some psychoeducation, talk about the things that we know exist. So, okay, you're moving from Texas to California. Do you have friends or family there? Do you know other people from your family members' unit that have moved there? What connections do you already have? What resources do you already have here where you live now that you might need in the future? Thinking ahead is really important. And as social workers, because the Social Work Interstate Compact is not live yet, we might think about, can we get this person connected with some of our colleagues in disciplines where the interstate compact is available? So maybe they could work with somebody in Pennsylvania who is also able to support them in their move to Colorado.
Yeah, definitely. And with that being said, understanding that there's these families are definitely really mobile, and it's something that we have to focus on understanding this transition. So, as mental health professionals, or through your experience, how do you tailor CBT or other structured approaches to meet these needs as our families are really mobile and moving?
Since CBT is time limited and very focused on building new skills, it's a particularly good model for families and individuals who need shorter term therapy. When somebody doesn't want or need therapy long term, it can be helpful to really set concrete and specific goals. I would say also being flexible about the frequency and being flexible about the delivery is helpful. There are certainly circumstances where I worked with military family members or veterans who were planning to move out of the area. So I said, okay, well, before you move, let's meet twice a week so that we can hopefully get you what you need and help with you being able to learn about your trauma or learn about your anxiety or develop skills in managing your emotions before you leave. And I do think that it's a really important thing to be collaborative and to actively involve clients in their treatment so that we are considering what they want and need. And that's part of the reason that after intake assessments, when I have a first session with somebody, I always try to be really flexible about the structure of that session. So we talk about goals. I'll usually say in first sessions after intake, I don't have much of an agenda besides talking with you about your goals. What are you hoping for over the next few months? What would that look like? How would you know that you were getting there? And I try to be really concrete and specific because a lot of times people come in my office and they say, I don't really know, I just want to feel better. And it's like, okay, well, what would better look like for you? Would you be happier? Would you have a better relationship with your partner? Would you be feeling more connected to your kids? Would you be able to manage stress at work? What would it look like?
Yeah, those are really great questions, especially when it's hard to identify those things, especially as clients. They can have those broad responses or answers. And so, really going into detail as what that specific term that they're using looks like for them. So, thank you for sharing that. Have you found differences in effectiveness between the different settings as you've worked through, like the homeschool and even telehealth services?
Yes, there are significant differences in effectiveness when people have more resources. So I have had the opportunity to work in lots of different settings, as Bonnie said earlier. Um, when people have more resources, they're going to be more able to engage in therapy regularly and consistently. And this is why case management services are so important. So if somebody doesn't have health insurance, that is going to be a real barrier to them being able to access all of the healthcare that they might need. If somebody does not have enough money to pay their rent or enough money to pay for their food, they are not going to be able to participate in therapy effectively because those needs have to take precedence. So I think that the settings, excuse me, where I've been able to do the best work are the settings where I either have known the resources or I've been able to get people connected to someone who does so that they have all the support that they need. Because obviously, somebody whose financial and logistical and basic needs are met is going to be in a different place in terms of their ability to benefit from therapy.
Yeah, thank you for sharing that. And with this in mind as well, are there any specific adaptations that you make when you're working like with telehealth, and this population?
The main adaptations that I would make for this population are to ask more questions. So telehealth means that somebody could be in a totally different place that you don't know about. And so I'll ask people questions about what their neighborhood is like and what resources they have. I also will do my own research. I'm not going to look at Google Maps and look like, okay, what does it look like literally where somebody is? But I might go on Wikipedia and look at their county and see what does it say about their county, population wise, who lives there, how many people are there, what is it like to be there. And this is obviously something we can do for telehealth with anybody, but particularly with military families, they are likely to be in an area where there's a base. And so you'd want to know, where is the base? Is it a base that sees service members in any branch? Is it specific to the Air Force? Is it specific to the Army? Is it specific to the Marine Corps? What's going on there? Who are the people who are there, and who else is seeing these families?
Yeah, thank you for sharing that. And even with that too, maybe keeping in mind some of the weather so we can come up with more creative ideas of coping skills that they would be comfortable with, and recommending vast ideas because if we can see like, okay, this client's now more in a really rainy setting, being really creative with, okay, maybe we do have to be more creative with indoor activities, or is that something that they enjoy watching or seeing, looking at? Or is it going to have effect, maybe even on their emotions? Because we do see, of course, weather having an effect on clients' emotions, just as we go through fall and winter, which some of us might love, but it can have really um, difficult effects on us because it tends to be darker and gloomier, and of course, those uh, shorter days, right? So, thank you for sharing that because we definitely do need to keep that in mind as well. So what are the challenges of establishing this therapeutic rapport, especially when it's this quick or short-term care, or they're just so used to so much transition and change?
I think that it's tricky, and we need to really be on our A game to be able to establish rapport when we know that it's time limited. So one of the things that I think we can do is, whenever possible, have the person who does the intake be the person who's going to work with the child or with the family, so they don't have to get to know a whole new person. We also can be informative about the process up front, and we can give families information on websites or through their initial contact to say, here's what this program is, here's what we can offer for you, and also to remind them frequently that we really want to help them with the specific thing that they brought, and that it may be the case that this doesn't fix everything and that they continue with longer term therapy elsewhere. Particularly if we're thinking about a short term model, it might be that you only see somebody for 8 or 12 sessions altogether. And so psychoeducation is obviously part of that, but also being attuned to what we're able to offer in each session, and we really want to provide good value. So offering resources, offering different interventions that are specific and thoughtful is very important here.
Yeah, thank you. And what are barriers to care, or sorry, what barriers do care, as far as like the military's families face? And how can systems be improved to meet their mental health needs in this aspect?
Unfortunately, military families face a lot of different barriers to care. They may face a barrier of care being available or accessible. There might be concerns about the repercussions of them seeking healthcare services. Fragmented systems make it really difficult, and there may even be an issue around a lack of privacy. So, if we think about it, somebody might be really reluctant to get the medical care that they need because they're concerned about it compromising their career, or they're wondering if this other person who is also kind of my coworker knows this about me, what is that going to mean? So that isn't just for the service member. It might be, what if my coworker knows about my family member's health issue? Are they going to judge me? Are they going to treat me differently?
Yeah, definitely keeping that in mind of the comfortability, of them sharing or taking time to share, but also keeping in mind the very short amount of time that we might be working with them. So thanking for mentioning that. Um, do TRICARE or VA systems pose limits to access to therapy for families?
Unfortunately, yes. A lot of people do struggle with finding providers who accept their insurance and who are culturally competent about their unique needs as a military family. Um, I don't know how long this is going to be ongoing, but as of where we are right now in 2025, there has been a huge issue with TRICARE reimbursement being delayed, and many smaller groups, smaller group practices have actually needed to change how they're doing things to account for either seeing a lot of military families and not getting paid on time, or changing who they see to account for the fact that there might be delays in reimbursement. The VA is often a healthcare provider of last resort for veterans, and so it means that the veterans who are seen there have higher needs, have more complex health needs, and most of the time, military family members are not going to be eligible for VA services at all. Sometimes couples therapy, sometimes family therapy, but frequently they're not going to be able to be seen there. And so it means that there's an issue with people getting therapy that is appropriate and adequately informed about their unique needs as a military family member.
Yeah, thank you for sharing that because that's definitely a really big eye opener, and maybe hopefully for some of our listeners to understand the services that are being provided and the severity of who is receiving that service. So, how do issues like stigma and confidentiality concerns impact this service usage?
I would say there are two big things here. One is long wait times, and one is that people may not get the support that they need. So, if somebody's worried about stigma, somebody's worried about confidentiality, they may end up going outside of the healthcare system that is more readily available, like on base. And it may be that they end up waiting a long time because it's hard to find a provider who takes their insurance, or it's hard to find a provider who understands their unique needs. So, if we think about it, if you have an issue with depression or anxiety, most mental health professionals are going to be able to help you with that. But if you have a specific issue with something that is rarer or more specialized, it might be harder to access services that are appropriate for your needs. Like if you need a specific kind of medical care, or if you need a specific kind of mental health care and it's not available in your area, you might either have to go without, or you might have to pay out of pocket, which is obviously not going to be realistic for everybody, even if you do have a PPO plan that offers reimbursement. It just makes things more complicated. And it might mean that people wait a really long time and that things could even get worse.
Yeah, definitely. And with that, keeping in mind, as you shared earlier, the employment struggles or unemployment struggles that they might be facing. And so that bigger difficulty in being able to support themselves or support their family in getting these services. So definitely keeping that in mind, as far as if we have a family coming into our practice, and how important it is for them to have gotten here or get that resources for them as well. So thank you for sharing that. And what would that role that a social worker can play in advocating for this broader system change?
I think the biggest role of a social worker in advocating for broader system change is going to be education and advocacy. For example, I always make a point of incorporating a couple of pieces of education into my informed consent. So when I am seeing clients over telehealth, which is all of them right now, because I work for a group private practice and do not have access to an in-person office. So I remind people, I'm only able to see you in Pennsylvania. If you were in Texas or New Jersey or Florida or California or some other state, I'm not licensed there. And I've talked to people about the Social Work Interstate Licensure Compact and other interstate licensure compacts. People do not know. A lot of the time, our clients think, oh, telehealth, I can be anywhere. It doesn't matter. I one time had to tell someone she was not allowed to be in Canada, which is kind of funny in retrospect, but it's just people don't know. And I think that we have a responsibility to help support and educate our clients. So if someone says like, hey, my dietitian said something about my weight, and I say, you don't have to work with somebody who is going to be judgmental and who you don't feel good about working with. Do you want help finding another provider? Or if someone's doctor is not listening to them, I can say, what what has worked for you when you've seen other doctors? Do you want my help in being able to switch and find someone new to work with instead?
Yeah, definitely. And being aware of the changes or movements that could be happening. Again, even if we're not working specifically with this population, like focused in on, but maybe in another type of practice where they're receiving these services and the clients move, especially with children, and not mentioning that this change has happened, because we want to make sure that we stay within our limits of where we're licensed. So thank you for sharing that. And what are some key takeaways from your experience as far as working with military families that have really shaped your approach as a clinician?
One of the things that I want everybody to know is that this is a really fun population to work with. I really, really liked the military kids and veterans and families that I got to work with. However, it also can be a higher risk or higher needs population due to unique stressors. So one thing that I got really comfortable with was asking everybody about whether they have firearms at home, because we know that veterans are at higher risk for suicide, and also that they know more about how to operate firearms compared to civilians. So it's something that is important. Also, military life presents some unique stressors, so it's important to understand that. I think one of the things that was unique about my experience when I worked at the military family clinic is that we ended up seeing a lot of folks who were in the National Guard, and the men and women we saw serving in the Guard had both civilian life stressors and military stressors, and they weren't making very much money because they were only in the Guard such that they were doing a weekend a month and 2 weeks of active training a year. So they couldn't fully get their military lives together or their civilian lives in many cases. And so we would see these um, adults in their early 20s who were trying to figure out, should I go to college? I went to the military specifically to get these benefits, but also I'm not able to get my civilian career in order. It was just very challenging. And I will say we were very fortunate to have some excellent case managers to be able to help out with this. I would encourage you, if you end up working in a system that is serving a lot of military children and families or veterans, to try to advocate for that to be someone on your team so that you as the therapist are not responsible for all of that, because you can't do good work that way.
Yeah, and seeking that support because our practice is very broad, but also seeking that support around us as well. So thank you for sharing that. I'd like to go back to that topic of firearms. When do you ask this question and how do you ask the question?
Thank you for asking, because I think that a lot of people are really uncomfortable about this, and I have been there too. The way that I ask about it is to normalize it and to also talk about it in the context of risk. I will frequently talk about it with parents as saying it's important to me to make sure that your child is safe. But right now, I'm mostly working with individual adults rather than seeing kids. I have a couple kids that I see. So I would just say very matter of factly, I ask everybody about this. It's really important to me to know what's going on for you. And I asked, do you have firearms at home and how do you store them? Do you do you need gun locks? I don't have gun locks available to give people right now, but we had lots of them available at my previous shop. And so I would ask, do you store your guns in a safe? Do you store the ammo and the guns separately? Just asking people questions and being really matter of fact. You may be uncomfortable about it, and you probably will be the first few times, but it is better to ask and to know than to not know, especially because if somebody has some sort of new change that leads to them becoming more depressed or becoming more at risk for suicide, you already want to know what the landscape is and not be like, oh, do you have guns? They don't want to tell you that if they're distressed and they think you're going to take their guns away. That is a question to expect also. People will ask if you are going to take their guns away, and you will need to say, no, I'm not going to take your guns away. You're allowed to have them. I just want to make sure that you're being responsible.
Yeah, thank you for sharing that. And also understanding that Of course, it is something higher with this population, considering how they're already kind of trained on this and they're exposed to this within their work environment. So, keeping in mind what type of state are we in, that it might be more like normalized, and asking these questions to cover our bases, right? To be aware of what we're stepping into or what our client environment is like, and asking those questions. But yeah, thank you for covering that because it is important, and just as important, I think, because I think back to like some of my home visits that I would do really, really early on. Just as important as is asking about medication and where that is stored, how it's stored. Also asking these questions around firearms and where that's stored if it's something that is within the home environment. So thank you. And what is something that you would tell a new clinician who's about to work with this population?
I would tell them to go in with humility. You're not going to know everything off the bat. It's okay to ask questions. It's okay to learn. I also would encourage them to try to reach out to other people who have more experience and to ask what they wanted to know. So I have a very specific approach to working with a new population, which is I like to dive in and learn a lot, whether that's reading, watching videos, listening to podcasts, taking trainings. Figure out how you learn best and set yourself up to be successful by asking for help and support. So if you are starting a new job at the VA or you are starting a new job working with military families, you probably will have a lot of learning to do just in the span of learning your job. And while you're building your caseload, take some time to learn about what you might need and also learn what exists that can help support you, whether that is colleagues, supervisors, support groups on the internet, whatever you can find. Try to approach it with curiosity and know that you will never know everything. And it's okay to ask, oh, I'm not familiar with that acronym. Can you tell me what that stands for? As long as you do it in a way that is respectful, people will get it and it'll be fine.
Yeah, thank you for mentioning that, especially with this month. It kind of just depends on when we're tuning in, but with September being Self-Care Awareness Month, being aware of as a new clinician and even tenured, making sure that we are taking care of ourselves and not being afraid to ask questions that we're unfamiliar with. We're stepping into a new setting, we're stepping into this role as completely new. So it's okay to ask these questions, especially by others, to ensure that we do have those correct terms. Because we can Google some things, but is it going to give us the correct terminology? Now there's so many acronyms for so many things. So ensuring we are getting the correct acronyms, especially for a certain company or agency where they could have their own abbreviations for things or acronyms for things. And so being sure that we are aware. It might be a role or it might be something within the clinical setting that we should be aware of. So not being afraid to ask those questions because everyone has their own terms and language within each agency setting. So thank you for sharing that. And one last question here, as far as how important is this cross-sector collaboration in supporting military connected children?
I would say it's difficult to make it happen, but it's really important. So if we think about it, whether we're talking about civilian families or military families, people are in and out of lots of different systems. For military families in particular, they're moving from one to another more frequently. So it might be that the kids are changing schools. It might be that everybody is getting new doctors. It may be that your neighborhood is different. It may be that you have different after school activities available to you. So I think that it's extra important to coordinate care when we're thinking about military connected children, and it's more complicated So I would encourage you to talk with the family and the kids and say, I really want to help support you. Would you be willing to sign a release of information form so that I can talk to your doctor, so that I can talk to your school counselor, so that I can talk to your teacher and talk with them about why you want to do that? Because I think sometimes people are more receptive if you explain why you want to do something that they didn't understand otherwise.
Yes, definitely. Especially with that practice of transferring our records so that we can fill that gap because you mentioned it a lot of like they're moving and so there's this loss of what was worked on before or like especially in the educational system of figuring out if there's special things that are needing accommodations or vice versa that we can see across. So yeah, I'm glad that we are addressing this so that we can ask these questions to prepare the families and each individual within the family of transferring those records and having this communication so that they're set up for success in those new services that they'll be receiving to where they're moving. Awesome. Well, thank you so much for sharing this information with us, in which we were able to learn about identifying these common stressors and developmental challenges that are faced by these families, where we're able to learn and apply trauma focus or trauma informed strategies and evidence based interventions, as well as really understand how to evaluate these barriers. So, we really appreciate you sharing this with us, especially across all of the platforms within the home setting, the school setting, even within the community and telehealth. So I am sharing my screen here for us to see key resources if we want to look back on more detailed information. And of course, we can play back anything that we want to rehear as far as this being recorded to learn. And I just want to thank you so much again for all of this great information. I hope that we find it helpful to apply again, not only in serving this population very specifically, if we are or if we're not, knowing that these families and these individuals will step into our office at some point, no matter where we might be. And so keeping this in mind, and I hope that we find this training very, very helpful to apply. And being mindful of what questions to ask, what skills to apply, just as you shared that with us throughout this hour. So, thank you all so much, and thank you for all of the great information here.
Thank you so much for having me.
I hope you enjoyed this continuing education course from Agents of Change. Want to earn your CE credits for this course? Visit agentsofchangetraining.com or the link in the description to purchase the course and take the post test. If you're looking for more CEs, check out our unlimited plan. You will get unlimited access to 150 plus ASWB and NBCC approved continuing education courses for one low annual fee. We're always adding new courses. Did I mention we also have 5 free CE credits available too? Check it out at agentsofchangetraining.com.